With the patient's health history in hand, you are ready for the examination. Before beginning, let's review the structures of the abdomen. The abdominal wall extends from the rib cage above to the pelvis and inguinal ligaments below. The rectus abdominis muscles can be identified when a person raises both head and shoulders from a supine position. Palpation is easier lateral to these muscles. For descriptive purposes, the abdomen is divided by imaginary lines that cross at the umbilicus. These lines form the right upper, right lower, and left lower quadrants. The abdomen may also be divided into 9 areas. The 3 midline areas are the epigastric, umbilical, and hypogastric or suprapubic areas. The abdominal cavity extends up under the rib cage to the dome of the diaphragm. Most of the liver and stomach, and usually all of the spleen, are within the abdominal cavity. The normal spleen is mostly posterior to the left mid-axillary line. The kidneys lie posteriorly, partly protected by the posterior ribs. The right kidney is slightly lower than the left. To assess for kidney tenderness, you should be able to locate the costovertebral angles. They are posterior to and below the 12th ribs lateral to the vertebrae. The abdominal aorta, which may be palpable in the upper abdomen, bifurcates into the iliac arteries below the umbilicus. As the iliac arteries pass under the inguinal ligaments, they become the femoral arteries. The renal arteries branch off the aorta in the epigastric area. The intestines fill much of the abdomen. The sigmoid colon and portions of the transverse and descending colon may be palpable as tubular masses. Except for a pregnant or gravid uterus or a distended bladder, normal pelvic organs are not detectable through the abdominal wall.